Okay, good afternoon. Thank the organization for the invitation. And first of all, I see a lot of experience here. Well, I'm going to tell a bit about the nurses, which is the situation of the Spanish nurses. And well, I have to say that we are at our very first steps. So I work at the Niño Jesús Hospital in Madrid. Just as a reminder, the incidence of cancer of the ages between 15 and 19 is of 450 per year. And we wanted to tell you the number of the patients that were treated in our hospital above 12 years. This last year was a total of 28 patients. This is like 30% among all the patients that we see in our pediatric unit. Probably it's not the biggest percentage, but it is a very important group. So we have a concern about this. Nurses do detect that there are differences between our smaller patients and these patients. Examples that we have some days, or because of the circumstances, as a patient 19 years old that is mother and has to share a room with a 5-year-old patient. So they are at very different stages of life. So with the association, the Spanish Association of Adolescents and Young Adults with Cancer, we started to take our first steps. We created the Nurses Board last year. We decided to submit a survey for nurses from different hospitals all around Spain. And what we wanted to check is the nurses' view about adolescents and young adults with cancer. And we wanted to detect which were the needs that these professionals have when we have to attend them. The survey had 20 items divided in 4 big areas: training, information, resources, and the needs that nurses think that the adolescents have and our proper needs. We tried to contact a list of 309 hospitals, a lot of hospitals. And well, we had several difficulties. The first, it was a telephone contact, and if it was successful, well, we sent an email for them to respond to the survey. The difficulties, well, some of them said that they did not attend this group of patients. Others, that it was like sort of impossible to contact with the responsibles of the unit. Sometimes the intention was to answer the survey, but never the answer got back. And others that they had no oncology unit and the patients were sent to other hospitals. So finally we received 46 surveys from 46 hospitals, 46 of them from the responsibles of the unit, and 234 surveys from the nurses of these units. This was the distribution of the surveys we received from all around Spain. And which were our results? Well, 40% of the answers were from pediatric units, 60% of them were from adult units. And when we're asking if where must adults and adolescents and young adults be treated or seen, 60% of them answered that they must be in pediatric units, while 40% of them considered that they must be at adult units. We did analyze the surveys by one side, the ones of the responsibles, and the other side, the ones of the attending nurses, to see if there were some difference. We did find some of them, but not mainly. Most of the responses were very similar. About the first area that we asked was about training, and the responsibles were more optimistic about this situation. They said that the nurses are trained enough to attend these patients, while nurses considered that only 31% considered that they were trained enough and they had the knowledge, enough knowledge to attend them. Asking if we need specific training for attending them, both of the groups agreed that 97% would be agreed about it. The average of experience working in the units among all the nurses that answered the survey was of 10 years of experience. When asking a more personal question, as do I feel trained to address the specific needs, difficulties to attend these patients, Again, we find a small difference. Well-responsibles answer that 31% they don't, and nurses 46%, neither they didn't. We think it's a big percentage because it's almost half of them. Also, when we ask if it was complicated to provide care for these patients, 50% of them agreed that it is. Asking if adolescents and young adults in need of our attention, 93% of them consider that they do, and 99% consider that it is necessary to develop a specific care team for them. The second area of our survey was about information, and here 80% of the professionals didn't know where to accede or where was the access to the information resources for adolescents and young adults, and neither if there was something to assist professionals. So when we asked them if it would result interesting to have websites or similar available to guide and seek about the questions about them, 100% agreed that it would be interesting. And we see here the website that already has been commented here. And the third area of our survey was about the resources available for these patients. We asked if there is a specific area for adolescents and young adults, and 88% of them responded that there is no area specific for them to be able to meet or to share their concerns. When we asked if the units have a psychologist, only 60% of them didn't have psychologists. This we found it a bit surprising, mostly when we talk about multidisciplinary teams and when we are trying to work forward to a specific multidisciplinary team for adolescents and young adults. The fourth area of our survey was about the needs that nurses think that adolescents and young adults have. And one of the important things that we wanted to ask is if nurses know about the rights that these patients have. Responsibles answered that 42% of them didn't know about them, and nurses, 64% didn't know about them. Spanish law does regulate, has a law that regulates patients' autonomy and tells us a bit how we have to inform the patients depending on the stages and the ages. For patients between 12 and 16 years old, they have the right to receive information about disease and treatment, and they can consent themselves about some of the treatments, only considering if the doctor thinks that he or she is mature. And for patients above 16 years old, they are considered full age to receive all the information and also to consent about their treatment. Although it seems that nurses, we didn't know or we don't know about the laws and respect this team, but and when we asked about this on the survey, if they must receive all the information, 88% considered that they must, and also when we asked if they must participate and decide with the care team, well, 96% of them considered that they should. So we don't know the law, but I think we are working towards this. And which were our conclusions? Probably answering these two questions: what do they need and what do we need? We can conclude from the survey that we nurses need training, specific health education about treatment and care, about physical, psychological, social development. And on the other side, we would need a platform where we could have access to information, and it could be a guide for professionals and for patients. So again, here with the Spanish Association of Adolescents and Young Adults, the Nurses Board is looking forward to the next steps to take, and the next steps we think that we should be working on is to organize a course for professionals and to participate in the platform that is already working on, while providing expert information for patients and for professionals. And if we finally empathize with this group of patients, if we look back when we were teenagers and we were having fun, We were living new situations, building up new relationships, looking or trying to construct our future, looking of where we wanted to go for, and we would have a big stunned in the middle of our way. I think all of us would be stunned. So the other main conclusion that I wanted to talk about is, that I think the efforts here in Spain must go on, must be working to create units for adolescents and young adults with a specific care, and always taking and considering and thinking about what their greatest desire is, that is to keep my life as normalized as possible. So thank you for your attention.